In our mouth, we have billion bacteria which are staying. They're a part of our body, they're part of our mouth. You have it, I have it, everybody has it. They are having their own good time there. But when we eat food which is sticky, pizza, burger, cake, simplified carbohydrates, sticky carbohydrates, they keep on getting stuck to the tip.
Is this really true even today? If it is almost a 9 month of pregnancy, you actually need to avoid a situation of RC or extraction.
It is true. See, here it's not only your tooth that a dentist would be dealing with, it's two lives that the dentist is dealing with.
Within Gen Z and Gen Alpha, do they consult you more for teeth misalignment? Or is it more of beautification or aesthetics part of it?
Yes, Gen Z is obsessed. That is the word that I can use.
Dear friends, can you guess the Bollywood actresses from this image by their beautiful smiles? While the first one is my personal favorite, Madhuri Dixit Nene, the fact is all of them have won hearts of Indians and across the globe with their $1 million smile. Few are blessed to be born with beautiful smile, and few of us will need help of magic hands to get to this beautiful smile. I'm sure our smart viewers must have guessed the topic of today's sharing learning episode. Yes, we are going to talk about awareness on dentistry. Please welcome Dr. Sanjay Baiskar and Dr. Mrudula Sanjay Baiskar, an adorable couple practicing medicine in Mumbai in the field of dentistry. They have done their BDS from Amravati University and proudly possess more than 24 years of dental experience. Both are member of Indian Dental Association. In fact, Dr. Mrudula holds role of treasurer in IDA Thane. Both believe in keeping themselves updated with latest developments in their field and keep attending conferences and courses throughout the year. Dr. Sanjay holds postgraduate diploma for dental implants as well. He holds diploma in orthodontics. Dr. Sanjay specializes in dental surgeries and is practicing implants for last 18 years at Baiskar Dental Solutions, Mulund. Dr. Mrudula completed her postgraduate diploma in aesthetic dentistry with gold medal from Manipal University. She practices at Baiskar Dental Solutions, Thane with specialization in smile designing and cosmetic dentistry. Dr. Sanjay and Dr. Mrudula, what is the proportion of your patient base between school going, college going, mid-age and senior citizens?
Okay, I will like to answer this. We are 25 years into practice. What we practiced before and what we are practicing today, there's a lot of difference. And this shift is very necessary because we have updated ourselves with the dental evolution that is happening. And I'm telling you, this is the reason why I want to, start with this introduction to answer this question. Maximum proportion, I will say 60% of my cases are between the age group of 40 to 60. Now, this paradigm shift is since COVID. I think the priorities have changed. The way people look at dentistry has changed.
Right.
Now, after the age of 40, what happens is you have a stable income. Your majority of the family responsibilities are settled and health becomes a priority.
Right.
So that health drives you to a dentist.
Sure.
Majority of the cases come with pain. Let me tell you that also. Ki even now that change is still necessary, but it will come.
Right.
But out of 10 patients, 8 patients want to know about their overall health. They are interested to understand ki what other dental problems do we have, what are the treatment options that we have, and what kind of time and expense we will be looking at.
Right.
And 5 out of them do get the entire treatment done. Okay. So which is a very big shift. So no longer it is only symptomatic treatment. It is the overall treatment that we are looking at this age group.
Right.
And that is, I think, the another reason contributing factor to this is the way digital dentistry has come. Now, dentistry is no longer, me and you talking. There's a digital component to it.
Sure.
We have dental softwares which can predict and show mock-up results. Ki we are here and we are going to reach here. And so we can see it actually and show the patients. And we can make them understand the modalities. At the same time, thanks to internet and our Google Maya, the patients do have some education, some awareness, which helps. So I think all this has come together and we are seeing a lot of treatment, better options. So no longer it is symptomatic. It is overall health that people are looking at also, especially this age group.
Right.
See, the rest of the 40% compromises of people who are under 18, from 18 to 30
Right.
and 60 and above.
Right.
Now, the major concern in children is cavities.
Right.
And now the parents are becoming aware. See, they are only I will say the lifestyle is the cause that you are having so many children coming in with dental issues.
Right.
But parents are aware. They understand that there is a specialist called as pediatric dentist who addresses problems for children.
Right.
And they are keen about getting treatment done. I think another shift is no longer people are having better incomes, which is also allowing them to do this kind of treatments. I will say between the age of 18 and 30, the treatment is more symptomatic and looks.
Okay.
How is my smile going to look? How I can improve my smile? Do I need braces? Where this one tooth is like this, can I shift this tooth? So majority the thing is about the selfie era, the today's era,
Yeah.
where their reels and everything. So they want to look good on the camera. And that is what drives them to the dentist.
Right.
About the senior citizens, I will say the majority factor is missing teeth or the teeth which they have lost over a period of time.
Right.
And those teeth need to be replaced. And they are keen about getting replacements done. And now with the implants and the changing era, dentures is removable option. But now people are thinking of fixed options, and which is possible.
Right.
So that is what also drives them. Another thing is most of the senior citizens have kids or children who are abroad. Abroad dentistry is super expensive. We cannot imagine the cost of dentistry outside.
Sure.
So they do want to get the treatment done here. And the children are also there to finance their treatment.
Right.
So that is also one big component of my practice today. So this is how it is. But again, I'll come back to that. Key 40 to 60 age group is the biggest group that I am looking at. And this is the age group which actually regulates the other age group. Their children, their college going children and their parents.
Right. So if we move to the next one, which are the top 3 complaints or the requirements for which the patients consult a dentist or you,
Yeah.
basically. Yeah.
See, 90% of the times the driving force is pain.
Right.
I mean the nani which everybody remembers. I think she's the one who tells them to go to the dentist eventually. So वो दांत दुखने पे नानी याद आती है ना, तो नानी याद दिलाती है भाई अभी तो जा डेंटिस्ट के पास.
Right. Right.
So we have cases with patients calling in the middle of the night because the pain is so excruciating.
Right.
It's very difficult to go through the night, and they have already gone through that pain for the last 8-10 hours, somehow trying to bear it. The moment they try to go to bed in the night, that is the time when it really starts paining badly.
Sure.
And throughout the day, it's easier to go through the day because you're busy with doing something.
Yeah.
You're not actually looking at the tooth, and you're busy.
Right.
The moment everything quiets down in the night, you're sleeping on the bed, suddenly you realize it is throbbing,
Right.
and then the pain starts increasing. You take a painkiller, doesn't work, and then, I mean, as I said, Nani is remembered, and then Nani tells them to remember us.
Yeah.
So, in turn, we get a call in the night calling us saying that I have bad pain. We try to manage it by painkillers. Usually, there is not much of an emergency than pain, and it gets handled with an antibiotic and a painkiller. But yeah, that is the major driving factor, pain.
Right.
And rest of the complaints that we see are food lodgement because of cavities. So food lodgement is because of cavities, and then whenever the food gets stuck, and especially if it is something sweet that gives more pain, that is where people come to us to get it checked. And all these complaints, the basic thing is dental decay.
Right.
The dental decay is basic, wherein it has to be managed, and this has been going on for several months, but the pain has not come in. That is why the call never came in.
Yeah.
The call comes at the 11th hour.
Absolutely. Absolutely.
इट इज दॅट की ती ना कोथिंबीर आहे ना ती ना दातामध्ये अडकते. ते काय झालंय जरा बघता का, ती गॅप कुठून आली आहे. और दॅट चिकन, ते चिकन निघत नाही हो. आम्ही खूप प्रयत्न केला, इकडनं हे टाकलं तिकडनं ते टाकलं पण ते निघत नाही. सो दिस इज अनदर ड्रायव्हिंग थिंग दॅट दे कम फॉर.
Right.
And usually the observation is that it is only decay.
Right.
So I will say our teeth are giving us warning signals.
Right.
Like there is sometimes this tingling sensitivity. We see this ads, Sensodyne ka ads. where they say कि अरे sensitivity हो गया, Sensodyne, use Sensodyne. But that sensitivity is the tooth telling us कि I am in trouble.
It's an early trigger.
Yes, it's a
Yeah.
very early trigger. So I am in trouble, please see a dentist. But what do? We ignore it. We say
Yeah.
अरे देखेंगे
Pull
बाद
on.
में कुछ करते हैं इसका बाद में देखते हैं. But these are the typical signs. If you come early, it's dental decay which is a driving factor. Rest, just as I told you, it is aesthetics, how I look, how my smile is. It is about children who are having bad decays and senior citizens. Majority, 90%, it is toothache. That is what pulls you to a dentist office.
Okay. If toothache is due to the cavity problem, I think that's the prime reason, as you both
Yes.
mentioned. What are the top causes, which are leading to this cavity?
For this for to make you understand what is tooth decay and why this tooth decay causes for tooth decay, I will first like to tell you or make you understand what is a tooth. Okay, now it is a marvel. I'm a dentist practicing for 20 years, and still I'm marveled with the structure of a tooth. It is unique. Means I will give you a fun fact here. Teeth are so unique that they are like fingerprints. तुझे दात माझे दात ह्याचे दात कोणाचे दात सेम नाही आहेत. That is why we hear this in CSI and everything. Dental records matter because every tooth is different.
Right.
So that is one fact. Now a tooth is like a coconut. This is how I explain to my patients. It is like a coconut. It is having very hard surface outside. There is a softer surface inside, and inside is the water. So basically, when you see a tooth, the outermost portion is enamel.
Right.
Another fun fact, enamel is the hardest part in our body. It is harder than bone. But bones, when they fracture, they repair. But once enamel gets a cavity, tooth cannot repair itself.
Right.
That is why you need a dentist. But,
Sure.
Yeah. So enamel is the hardest portion. Dentine is a tubular structure. It has a lot of tubules together. Like just imagine a compilation of straws. And the innermost portion is the nerve, where we get the blood supply and the tooth supply. Now, the question that you ask is what causes tooth decay? It's a combination of many factors. In our mouth, we have billion bacteria which are staying. They're a part of our body, they're part of our mouth. You have it, I have it, everybody has it. They are having their own good time there. But when we eat food which is sticky, like pizza, burger, cake, or what we call as super simplified carbohydrates, sticky carbohydrates, they keep on getting stuck to the tooth. And this bacteria also want to eat it.
Right.
So they will go and try to eat that whatever sugar you have on your teeth, and they secrete acid. Any acid causes what you call dissolving of the enamel. And
Right.
as soon as they get an entry into enamel, we are done with. Enamel is just nothing but calcium and phosphates. इमॅजिन दॅट की आपल्याकडे पार्टी आहे, आपण सगळ्यांना पिझ्झा बर्गर वगैरे दिले, आपण खूप खुश असतो. आता त्यांच्यासाठी ही पार्टी आहे
Right.
की दे आर हॅव्हिंग अ पार्टी इन आवर माउथ नाव.
Sure.
So once a cavity starts, it doesn't stop. Once it will start in the hard portion, you will see that there is a small black dot, or you will see the food is getting stuck, or sometimes when it reaches the dentine, this cavity just keeps on going deeper and deeper. Once it reaches the dentine, you are going to feel that slight sensitivity, which is due to sweet or due to cold. आईस्क्रीम खाल्लं 2 सेकंदासाठी झिंजिण्या झाल्या मग थांबलं. सो दॅट इज आर टेलिंग अस की कॅव्हिटी आहे आणि ती आता डेंटिनमध्ये गेली आहे. अँड देन वेन वी डोंट टेक केअर अँड इग्नोर दॅट, देन इट रिचेस द नर्व. And that is where the entire problem starts. Then the pain, infection, everything sets in. So we have a lot of time from the time the cavity hits your enamel till the time you reaches the nerve. In between that time, you come to me. Treatment is just a routine filling. It's just in the hard portion of the tooth, and we are just doing a very simple job. The more late you come, the more extensive the treatment becomes.
So I think around 21 years back, my son was introduced to sugar candy, right, by one of our guests. He was so fascinated. He loved it. And obviously, his azuba, his grandpa, showered all the love by bringing that sugar candy almost daily, right? Obviously, eventually, he developed cavity. He was merely 2 years old. We consulted a dentist, and dentist obviously said, we will need to extract, right? As his age was so small, he was a toddler, he was suggested a procedure of giving a general anesthesia followed by extraction. Now my question is, today with 20 years gone almost, is there some kind of advancement in the technology which can avoid this stage because I believe it is a very painful process for a toddler and the parents to see the kid in so much of pain, right? So, is there something different which has happened over 20 years, for this kind of situation?
See, the problem with a 2-year-old toddler is that they're not stable.
Right,
The age is such that it's very difficult for us adults to explain it to them that they have to stay still for the treatment. That's not possible.
right,
And then if it's a root canal, even for a single tooth, it would go for multiple appointments.
sure,
So the child would sit probably once, but learning from the first experience, they'll never come the second time for treatment.
right,
And the other thing is, they kind of get fear instilled in them that dental treatment is painful. And then there are other environmental factors like parents, friends, other children trying to tell them बहुत दुखेगा तेरे को तकलीफ होने वाला है. So those things are important. So many a times the best route taken is for GA. With
okay,
that you can do multiple teeth in one sitting.
sure,
Multiple treatment options are there. You finish everything in one go. The child doesn't remember anything. At the end of the day, I mean, even the parents are happy because it's very difficult for the parents also to see their child go through this pain every day.
absolutely,
So it's very difficult, and the easiest option is general anesthesia, but with a pedodontist, a
right,
pediatric dental doctor who specializes in treating children.
right, right,
That's always a good recommendation. And
okay,
I would say, but when it's absolutely necessary, when it's routine treatment, uh, the pediatric dentists themselves train the children so properly that they're not scared of the treatment at all. So yes, that also is there.
So, can fluoride treatment be helpful in this stage, or is it always going to be extraction?
See, it depends. I would come to this. It depends upon the stage in which how destructive the tooth is.
Okay,
Fluoride is a preventive option.
okay,
It is not a treatment choice
sure,
for a problem.
okay,
It is to not cause a problem. We use fluoride to make sure that the tooth doesn't decay.
okay,
But once the decay sets in, then fluoride is of no use.
okay, understood.
Another thing is to address your previous question, I will like to add this. Ki the pediatric dentists, they have trained themselves to handle kids.
Okay,
Okay, so majority of the cases they know how to handle. See, kids are not adults.
right,
They are not going to understand when you tell them की अरे तुला शांत बसायचं आहे. In fact, there is so much phobia कि when they see those dental instruments, the doctor with the gloves and mask, they are shit scared.
right,
Means they are scared. So what
Right.
they will do is कि they will want to rebel in some or the other way.
right,
So a pediatric dentist is trained to handle such cases.
sure,
So the cases like your case, a 2-year-old is very, very young.
right,
It is very young. If I will say a 5-year-old comes in and he is having issues, tantrums, still a pediatric dentist will try to take 1 or 2 appointments to see if he can handle him, make him
Okay.
understand with their own language and their own techniques. If that works, then we need not do a general anesthesia.
sure,
But in cases like this, where they're too young or they're mentally challenged or there is autism involved,
Right.
where it's difficult to make the child understand what he's going through, then in such cases, very, very some margin of cases, a GA is
okay,
this thing. In such cases, the hospital admission is done. Anesthetist plays an important role, and the pediatric dentist.
okay,
And it is very safe. Like there is nothing to be very scared of it. It is not advised unless it is necessary.
sure,
And rest all the things a pediatric dentist also manages in his routine practice and routine clinic. So
okay.
that is what I would like to
Understood, understood.
that point.
I think that reminds me also of another personal experience of mine, which I wanted viewers to know possibly, is I think 24 years back or more. I think when I was pregnant, right? I think it was almost nearing 9 months. I think I had developed a cavity and obviously a toothache. Uh, I consulted a dentist again, and he recommended that at the stage I am in of pregnancy, I should not have heavy dosage of medicines.
Yeah.
And he also told me, maybe one of his experience, that at times it could lead to labor pains. Okay. Somehow it developed a phobia for me, to the extent that the BP got shot, right? And it had some complications later for me in my delivery. So obviously I was in able hands of my gynec and he handled that case well. But I think my question here is this really true even today? That if it is almost a 9 month of pregnancy, uh, you know, you actually need to avoid a situation of RC or extraction.
It is true. Reason being, see here, it's not only your tooth that a dentist would be dealing with, it's two lives that the
Right,
dentist is
right.
dealing with.
Understood.
And at this point, the pregnancy is is gone
Yeah.
so ahead, and there are already other things that the woman is facing through the, it's the final stages of
Right,
pregnancy. It's
right.
it's difficult. And then the moment we start some medication, even this much of change in medication or give administering local anesthesia actually can initiate certain problems,
Sure.
which I mean, at all costs, any doctor or dentist would like to avoid, getting any problems in the final stages of the pregnancy. So still today we just maintain that same thing. We avoid any antibiotics. We give very basic painkillers, nothing beyond a paracetamol usually. That's what we are supposed to do. But then the final call is of the gynecologist, what medication has to be given. And even if I prescribe something, I tell my patient, please show the prescription to your gynecologist
Right.
and then go ahead with the medication.
Sure.
But yeah, it's a very crucial thing that you just said. And treatment would differ in the first trimester and second trimester of pregnancy. The second trimester, that's what we consider the safest usually.
Okay.
uh, but yeah, many treatments can be done in the first trimester also.
Okay.
Usually it's the swelling on the gums
Right.
with pregnant ladies, so the simple solution is just to get a cleaning done that takes care of the problem.
Okay.
uh, that's it.
Okay.
That's it.
Sure. Thanks.
Mm.
So, for a person with cavity, when is root canal a recommended option,
Mhm.
and what is the typical process followed and the charges involved?
You want me to take it? Okay. Just as I mentioned earlier, कि a dental decay always starts in enamel or in the hard portion of the tooth. It depends on what stage the patient is walking into my practice. If a patient comes with pain, many a times the decay is already involving the nerve and the pulp, which is the center of the tooth, and the infection has gone into the roots of the tooth. Now, what is the root is what structure we see in the mouth is the crown of the tooth. And two-third portion of the tooth, the roots are embedded in our jaw. And that is how we are able to bite on our teeth. We are able to, eat on our teeth. Now, this pulp is in the center of the tooth, and the supply, the blood supply and the nerve supply comes from these roots into the tooth. So imagine if the cavity has gone and hit the nerve or the center of the tooth, immediately you get decay and pain and swelling. You are not able to bite on it. So basically, it depends on the stage of dental decay. If the decay is in enamel and dentin, we try our best to do cavities or fill these cavities with filling materials which are available today. So it becomes a routine filling. But if the decay is already so bad and there's a destruction which I can see that the pulp is involved, then we advise कि root canal is the option. Again, it depends on how much structure I have left. The tooth structure. Like a tooth is a solid 3D thing. But if so much portion of the tooth is gone and there's hardly anything left, then even a root canal is not going to suffice. So destruction level of the coronal structure determines whether I can do a root canal or do I need to extract it and do an implant. Another thing which matters is how much bone support do I have. Suppose it's a tooth with a good coronal structure, but bone level is not there. I cannot root canal it and give a cap and then the tooth is not going to survive. So viability or understanding what is the long term consequence of my treatment or how much predictability I can give to this tooth case. If this tooth is going to last you for 5 years, 10 years, or it will last you for 20 years. I feel that determines which treatment option I'm going to decide whether it's an implant or a root canal. Now, what is a root canal? जसं as I told you की रूट्स आर देअर बेसिकली रूट कनाल रूटच्या आतमध्ये असलेला एक कनाल किंवा एक त्याच्यामधनं रूट कनाल इज बेसिकली द कनाल थ्रू विच ब्लड अँड नर्व सप्लाय कम्स टू द सेंटर ऑफ द टूथ when we do root canal we will basically clean this area. Now that the infection and all the bacteria have gone into your nerve, from there they have a direct access inside the bone. And that since there is no other way to go because everything is hard in our mouth, so they go inside our nerve, inside the root, and they start forming infection below. त्याच्यामुळे we are not able to bite. You have this people come with huge swelling because pus gets developed there and
Right.
there's nowhere else to go. So suddenly you see swelling again. Basically, the infection is through the tooth inside the jaw and you have a swelling. The pus has got developed.
Right.
So depending on this stage also, this also makes me realize ki how far is this infection? Whether it is involving the entire roots, whether it is in the center, there's something called as furcation. The tooth roots, they get divided because it needs anchorage for able to bite. But if the infection has already reached the furcation, I cannot reach it. So in such cases also root canal is not option. Now, root canal is basically cleaning, shaping and filling of these roots.
Right.
That is how a root canal, I will say, in very smaller words. This treatment is usually done in a dental office under anesthesia. Before, there are multiple appointments needed when the infection is very severe. If the infection is not so much and it can be controlled, we need 2 appointments. Today, even one sitting root canals are also done. This is also routine practice. So it depends upon the level of infection that I'm seeing on my X-ray. It is also the symptoms that my patient is giving me to be able to diagnose ki what is the infection level. That allows me to decide. I can tell the patient 2 sittings लागतील, 3 लागतील किंवा आपल्याला 15-15 दिवसांच्या सिटिंग्स घ्यायला लागतील कारण इन्फेक्शन एवढं जास्त आहे की आय हॅव टू पुट सम इंट्राकॅनल मेडिकमेंट टू कंट्रोल इट. So depending on that stage, we do the root canal. Cleaning, shaping of a root canal is done with instruments which are called as files. They are made of metal. You will be seeing this typical files that a dentist use and you are wondering what is happening. So basically canals are very narrow.
Okay.
Now anything if I have to fill something narrow, I cannot fill it. आपल्याला कशात तरी काहीतरी भरायचं आहे. जेवढं कमी आहे तेवढं तो नीट जात नाही. But bigger the thing and you can easily fill something. So we basically increase the size of that narrow canal to a size where we can easily fill it and we can give a predictable result. So today root canals have changed a lot. Earlier people used to always feel की root canal म्हणजे पेन होणार आहे, खूप दुखणार आहे, डॉक्टर आता मी कसं सहन करेन. But the instruments, the technology, just as I said, what I was practicing that time and today, tremendous difference. Today we are having something called as RVGs. Majority of dental clinics have RVGs.
Okay.
These are X-ray machines in which I take a X-ray and it is seen on the computer screen.
Right.
So I can actually shoot 10 to 15 X-rays to just check whether I have reached that perfect level of my root. Because root canal is a blind procedure.
Right.
I'm starting in the mouth, but everybody's roots are different, length is different, the structure, the anatomy of a root is different. So I can just do it looking at an X-ray. Okay, I have reached to the bottom of the infection, I have reached to the right level in the apex, that is called as the apex, the end of the root. So I have X-rays to take. So I can take n number of X-rays because the exposure is so less. It is not at all harmful. Before, the exposure used to be a big thing. You had to develop a X-ray which used to take 10 to 15 minutes.
Actually.
Yeah. So you used to be sitting, अच्छा X-ray लिया है लेकिन अभी रुको, बाहर जाके बैठो. Now I take a X-ray, see again I take a X-ray. So I can keep on, taking, skillfully doing my treatment. Second thing that has changed is the way those files are used. Before we used to have only a hand filing. When we used to use the files, clean it and fill it. Today there is something called as a rotary instruments.
Okay.
So these instruments allow us to do the cleaning with a motor.
Okay.
So what I used to take around 40 minutes, I can do in 10 minutes.
Okay.
So that, and it is very easy to do it. Once I have reached a certain length, I can easily now start cleaning with the rotary instruments. It gives me a better handling and I am better at what I'm doing.
Right.
And the third thing is there is something called as apex locators.
Okay.
Now apex locators is something which I use to judge and see where my apex is. म्हणजे रूटची लेंथ काय आहे, आज 10 आहे, 15 आहे, 20 आहे, it gives me a signal. You have reached the end.
Okay.
So then I again confirm with the X-ray. So I have all these things at my disposal. So I can do a much better treatment than what I was doing maybe 20 years back.
Sure.
And that has changed because now I'm not going beyond the root. I am trying to do and remove the source of infection, the pain factor, inflammation factor, everything gets reduced.
Right.
And at the same time, filling, now there are so many things. We are doing 3D fillings. Liquid gatta parcha is filled inside the tooth. Many people are doing. So now you are filling to the, म्हणजे आता काही उरलंच नाही की जिथे आम्ही स्पेस सोडली आहे, काही सोडलंय. So root canals are easier.
Right.
They are predictable. You are giving better results. So this is how a root canal process is. Now this entire thing can be done in one sitting. It can take multiple sittings. Sometimes there are complicated root canals. In the case like a 60-year-old
Hmm.
or 65-year-old person needs a root canal. They are with aging, the tooth anatomy changes quite a
Right,
bit
right.
inside. So in such cases, I would prefer that a endodontist who is a specialist doing only root canals. So many cases I call in my endodontist also, where I feel that I need his expertise. So then when he comes and he diagnoses a case and he decides that this is the treatment that we are going to do, he may require 1 sitting, 2 sittings, 3 sittings. So all this has made root canals much easier. That is what I will say.
Sure.
Much predictable, and there's nothing to be scared in it.
Right.
Still the scare factor is going away. Patients are more means now I have patients walk in, madam एका sitting मध्ये नाही होणार का root canal, because it is the time consuming factor has become less.
Right.
म्हणजे 1 sitting you come to me and you come for 3 sittings, you would anytime prefer 1 sitting नाही होणार का, then I have to explain कि अरे the infection level will not allow me, so I might need 2 sittings. Or if suppose I see कि infection is so much कि I have to do intracanal medicament, then I say कि okay, I will require 4-5 sittings in a period of 15 days and we'll do 1.5 month treatment. So it depends. Diagnosis depends upon the level of infection.
Right.
So root canal clear. Any questions in
I
this?
think we did not cover the charge part possibly.
Oh yeah. Again, the charges in a typical root canal case, I will say, will start from 6,000 to 12,000.
Okay.
It depends upon what kind of machinery you're invested in. I told you very different machines that are used in root canal today. The machinery costs a lot. It is a very heavy investment for a dentist. At the same time, it depends upon his expertise.
Right.
A person who is young probably will take time to do that treatment. A senior practitioner probably it will be easier.
Sure.
So it depends upon your level of expertise, and an endodontist is always going to charge more because that is his specialty.
Specialization. Yeah.
Yeah, it is his specialization. So anytime I tell ki endodontist is going to come in, the charges are going to be more.
Right.
Because it's sure short treatment. So that is how it works. So charges around 6,000 to 12,000
Sure.
would be what I will look at.
Okay.
And anything else about root canals?
I think you covered most of it. You did.
Okay.
Right. So on these similar lines, if we have to understand on what is the typical procedure for extraction with implants, maybe you want to throw some light on that.
I think that he will take.
Yeah. See, after everything has been done with the tooth that Dr. Mrudula explained right now, comes the implant section.
Right.
Let me stress on the fact that we try to usually, not only we, but many of the dentists and doctors, they try to maintain what is natural. So the first attempt is always to save the tooth, the patient's own tooth.
Right.
If that fails in some cases, then the option of extraction and implant comes into play.
Right.
Now, 18-20 years back, we used to be told that extract the tooth, wait for some time, then you can think of an implant and all those things.
Or bridge.
Or a bridge. So things have changed a lot after that.
Right.
I mean, these days, it's all, of course, there's a level of infection in that tooth that we check out. But many a times it does happen that if a tooth is questionable and it needs an extraction, so we may start with the root canal thing. We try to assess the tooth, and if it's not possible for us to save that tooth, we may have to tell the patient to go in for an extraction. At the same time, we give an option, do you want to get an implant done now? So 2 or 3 things can be covered in the same thing. But yes, you have to be prepared with everything that you need to do. I mean, you'll need a good kit for doing your root canal. You'll be having to do fantastic extractions where there is no bone destruction. At the same time, you'll have to have very good implants and good infection control to do the implants. So that is possible these days. Now, what's an implant? Now that we have come to implant, what exactly are implants? I mean, we just know that they can replace natural teeth.
Yeah.
How do they replace natural teeth? They are basically tapered implants that are made out of titanium. They are root shaped implants, you can say. So because they are root shaped, they try to mimic the natural shape of the tooth, and they have a porous kind of a surface where they allow the bone to grab it tightly.
Right.
So essentially, an implant, once it's put in place, say I extract a tooth, I get good space to put my implant, I put my implant inside. As the wound heals, the bone grabs the implant.
Right.
Because the surrounding bone usually will grab the implant. If the bone is less, then we need to add some bone, and then the bone grabs the implant. So that is what an implant is. uh, Coming to the procedure, implants is always usually a two-stage procedure. Two-stage meaning we first put the implant, and the second stage is loading the implant. Now, loading the implant is essentially putting a cap on top of it.
Right.
So it basically gets loaded so that it can take all the stresses of chewing. Now, earlier days we never put a crown immediately on top of implants. Reason was always let the wound heal, let the implant get integrated with the bone, and then you can put all kinds of stresses and loads on top of it.
Right.
But these days even that has changed. Implants that have come in today are so good that you can give temporary crowns, which may function as temporary till the second stage. The time for the second stage is usually 1.5 2 months. It might be more in certain cases depending on
Right.
the implant and the site where the implant was done. But this is how two-stage implants work.
Okay.
And now, because implants have come in, a lot of treatment options have opened up suddenly. Earlier people, specifically senior citizens who are above 65, 70, who somehow have lost all their teeth, the only option was those removable dentures they used to
Right.
use.
Right.
But that has changed because of implants. We can do implants and give them fixed teeth where they don't have to compromise the taste of their food. Because I said dentures cover the whole of palate, a bit of the side of the cheek. So that is why food doesn't taste completely, truly the kind of food that you're eating.
Right.
So with implants, it is possible to give them fixed teeth which doesn't have any extensions and wherein the taste of food is not compromised. So yes, it has increased the quality of life for senior citizens specifically who need complete dentures.
Right.
So it can be a case where most of the denture or the fixed teeth are given on six. So there are six implants in one jaw,
Okay.
and we can give all the fixed teeth on those six implants. In certain cases, all on four are also done. So those options have opened up about for specifically for senior citizens, and in young people where they have to lose a tooth, implant is the best solution. It immediately replaces the tooth, and you have
Right.
something fixed wherein you don't need to compromise the adjacent teeth. So before implants came in, earlier there used to be bridges.
Yeah.
So for that bridge, the adjacent teeth were grinded. Those innocent teeth, poor things getting grinded just because they want a replacement for the adjacent tooth.
Yeah.
All that has gone today, and people are also getting aware. There is a
Right.
lot of awareness.
Right.
So that is making a difference.
I think you touch based upon the senior citizen case. So I had actually a question around it. So if you have a patient consulting you, wherein possibly gone through angiography, angioplasty. So basically, heart patient has multiple comorbidities
Yeah.
like diabetes, right? Uh, what is the typical process followed, or is there something different as a care taken for handling these cases?
Uh, Definitely yes. A bit of difference is there when you come to handle heart patients. So because usually after angioplasty or graphy, usually the doctors themselves, with the cardiac consultant, will usually advise these patients not to go and undergo any procedure for the next 3 to 6 months.
Right.
That is the usual window they suggest.
Sure.
And still, in spite of that, they have to go in for some emergency treatment. They always come to us, and then of course we get everything checked. Usually this cardiac patients will be taking blood thinners. They may have a bit of diabetes, because it's a very normal thing to have patients who have diabetes and blood pressure, or
Right.
both the things
Right.
together.
Right.
So get the diabetes checked, get the blood pressure checked, and always tell the patient to go back to their cardiac consultant for a consent, wherein the consultant is aware that yes, something this patient needs to go through. So they give a consent to us that yes, you can start with the treatment. In case I'm going undergoing a extraction, then if they're undergoing a extraction, then they may need to stop their blood thinner. usual time period is around 3 to 4 days, depending on the blood thinner they are taking. So of course the cardiac consultant is a very important person here, because it's their consent which allows me to work on these
Right.
patients.
Right.
And HbA1c, that's the usual thing that we always check with these
Right.
patients.
Right.
So the level of diabetes has to be in control.
So if it is high, what is the recommended step then?
First, control the diabetes. Usually, these patients have their own diabetologist who may, change the dosage of medicine that they are taking, or recommend something new which would help them control this diabetes.
Right.
And in if that window of 6 months is gone by, wherein they had already covered their procedure and they are doing well,
Right.
and they need an implant is possible in a diabetic or even a heart patient.
Okay.
It doesn't disqualify them from going in for any more treatments. That's
Okay.
a very important point, because many people feel, I just cannot go through any more treatment now. I have already had my heart surgery, or I have got a stent. How can I go ahead with the treatment? Fine, you need to wait for some time, but after that, you can definitely go ahead with the treatment.
But for these cases which have high sugar levels and they are in tremendous pain, how does it go as a process then?
See, first thing is to control the infection.
Right.
To control the infection, obviously, antibiotics.
Right.
So we give antibiotics, we control the infection. At the same time, check with their sugar level, because usually there is a spike in sugar level, or there is something going on with their medication.
Right.
Probably a dose was missed, or the medication they have been taking for a long time,
Right.
and it was never adjusted. The sugar was never checked, and probably the dose is not sufficient. That is where the diabetologist comes into play, to increase that dose or change the medication
Right.
to
Right.
control the sugar properly. And once the infection is controlled, then only we can go ahead with the procedure.
Okay.
That is what we follow, and most of them do.
Okay.
Yeah.
Okay. Is there a case within patients wherein, because of the fear of pain, or possibly the cost factor, they insist, I do not want to go with implants and I want to go with RC only?
No, they want to go with
RC option, root
RC
canal.
option. You can answer that.
Yeah, there are patients who do believe ki do a filling. It's not even a root canal. They come with this pain hai, lekin aap wo the cavity hai, just fill it up.
Right.
And it is very difficult for us to make the patient understand that this treatment option is not the viable option, or it is not the option for you.
Right.
At the same time, the cost factor does come in. It becomes an issue. Still, things are expensive, for some people. Then what we make them understand is, let's control the pain. Let's do a phase treatment where we address only this problem at this moment. Whether now if the patient comes ki nahi root canal hi karo, but root canal is not possible, and an implant is advised, then we say ki get an extraction done today. Let 1 or 2 months go by. When you're having the capacity, come back and we will place an implant. Even
Right.
after placing an implant, just as Dr. Sanjay explained, it's a 2-stage treatment. The patient has time, 2 months more,
Yeah.
till we load the final crown.
Right.
So we can phase it. We have to understand. See, it is both ways. We have to understand what the patient's requirements are and what treatment options we can give and how we can accommodate it, so we do the best for him.
Sure.
Yeah, but there are people who come in and it's very difficult to convince, but we have to convince them. There's no other option.
Right. Right.
Another thing is, what I explain to the patients is, like in this case, what is the appropriate treatment is the appropriate treatment. When you go with any heart issue to a doctor, sometimes they will just control it with medications. Sometimes you might need angiography, angioplasty. But when the patient tells you that, when the doctor tells that to the patient doesn't argue. He says, "Zara kar do baba, kya hai?" Same thing goes in dentistry also. It is a organ. It's a part of our body. So when we tell the patient कि ये करना पड़ेगा, कभी sometimes they agree, sometimes it's difficult to convince, sometimes they don't agree, they take multiple opinions. That also happens, but it's a
Right.
part of practice.
Sure.
So, and answering that earlier question where you said ki is root canal an option or implant, usually root canal is the best option that we look at. It is how open heart is the last option that we have, and depending on the damage, it's after all about damage.
Right.
Heart किती damaged है, त्याच्याप्रमाणे we go ahead. So it is something similar.
Right. I'm not sure, Dr. Sanjay, whether we covered the rate part for implants.
No, we have not.
Yeah.
See, implants typically around 30 to 40,000, even 50,000 implants are there. It depends on what kind of implants the doctors are using and also the patient wants. So there's a thing. And yes, of course, the skill level of the doctor, that is what would command the cost of the treatment.
Right.
But yes, this goes around 30 to 50,000
Sure.
usually.
Understood.
It's about what system a doctor is using. We have
Right.
Indian brands, we have Chinese brands, we have very good manufactured German brands. So if the expense to a doctor is more, depending upon what quality of implant he's doing, the cost of the implant increases.
Obviously. Yeah.
That is one part of it. Another thing which dictates is how many implants you're putting in. Sometimes there are many implants, like he said, all on 6, all on 4. So that becomes a very big case because we are trying to actually treat the all 28 or 32 teeth for that patient.
Right.
So in such cases, we do consider where the treatment is discounts are considered because it's a long treatment for the patient as well as
Right.
it's so then the expense part is reduced a bit. But
Sure.
it depends upon what type of kit and what type of implant you're putting in. Another thing is what are you giving in bone? He said in some cases we have to put bone from outside
Right.
because there's a deficiency of bone. Then the cost increases.
Sure.
Sometimes when there is in the upper jaw, we have porous bone and we have sinuses. We all get sinusitis, especially this season. We all are having
Yeah.
surgery. So the sinuses don't allow us to put implants because they drop down once the tooth is extracted.
Okay.
So in such a case, we have to take it's called a sinus lift. It is a particular thing that happens in implants. It's a procedure. So when you lift a sinus, you need to put bone.
Okay.
And then you can put in an implant because implant has to be covered by bone. So in cases, the bone is also costly. So that factor increases. So it can go from 30 to 50,000 depending upon what procedure, placement, choice, where is the position of the implant is,
Right.
and how many means how many implants are you putting in. All these factors come in for the charges of implant.
So the end-to-end cycle for implant will be around 2 to 3 months is what we said, right?
Yes.
Yes.
There are immediate loading implants also today.
Okay.
The newer systems have come in which they are allowing us to load the implant immediately after placing it in.
Okay.
But still, we are not.
We are old school, so we follow the two-stage thing still because that gives me short predictability of how long the implant is going to last.
Okay.
That's how I function.
Sure.
But yes, in certain situations, you have to. I mean, it's a front tooth.
Right.
I cannot send back my patient with a front incisor missing and saying कि तुम्हारा implant हो गया अभी 2 महीने बाद आओ. I have to give them a temporary tooth.
Temporization also is a very big part of implants.
Sure.
So in front cases or complete denture cases, like we are doing all on 6. Like in one jaw, 6 implants have been put in. We are going to do fixed treatment. But for this 2 months, patient can't go without teeth.
Right.
He has to eat, he has to drink, and the age is also, high age,
Yeah.
above 60.
Sure.
So in such cases, we do give temporization of complete dentures or temporization of acrylic teeth, bridges, which are not taking support of the implant, but they're taking support of other teeth or jawbone.
Yeah.
So temporization is a part of implants as well. So this factor also increases the cost.
Okay.
That is what I'm trying to say.
Sure.
Right?
Sure.
Yeah.
Yeah. So I think you briefly touch based during the first part, but maybe elaborating it further. Within Gen Z and Gen Alpha, do they consult you more for teeth misalignment, or is it more of beautification or aesthetics part of it?
Yes, Gen Z is obsessed. That is the word that I can use. Today's technology of mobile and the cameras and the reels and Insta has a very big impact on this age group.
Sure.
Yeah, because if you know, majority of them are clicking pictures, so they smile, and the confidence that the smile generates makes a very big difference to them.
Right.
So these people we are seeing a lot of these cases where they come to our practice and they want to do something about their smile. They want to correct the misalignment. They want to close the gaps. They want to take the teeth backwards. Every case is different. Sometimes they come to me and they say, कि अरे वो heroine है ना माधुरी दीक्षित की smile. I want a smile just like hers. This is also how they approach us.
Yeah.
So then we have to work on their teeth. There are many techniques that can be used. There's something called as smile designing, But smile designing comes later. First is always braces or orthodontics.
Okay.
और basically braces और wire लगाना means metal braces and wire. जस्सी जैसी कोई नहीं थी. We all remember that.
Yes.
So something similar to that. Braces is a one big component. Another thing is smile designing or cosmetically doing a smile, where the veneers are. If you have heard people put veneers and they do a veneer planning of smiles, that is another part of. So there are two factors of treating such cases. And then alpha, when we were young, or I will say again, I think that it was about economics at that time, and teeth were not such a big priority at that point of time when Zen alpha was of this age. Today, we are having patients who are 40 and want to change their smiles.
Right.
They are also coming in. It's time we didn't do braces. We couldn't do it. We didn't realize it, or we were ignorant about it, or neglect happened. But now we want to correct it. So we do treat patients above 35 years of age also for misalignment of teeth today.
Okay.
Or people who want to improve their smiles. We do veneer cases. We do complete smile planning. We do a lot of such cases also. Coming to orthodontics, he can answer you better.
See, earlier many treatment options were not available. Now, with advent of technology, with changing times, changing requirements, things have changed. I mean, a lot of new things have come in. Earlier, they used to say 15-18 साल के आगे आपका ब्रेसेस का ट्रीटमेंट नहीं होने वाला है, और इवन इफ इट वाज डन विद अ लॉट ऑफ कॉशन.
Right.
Now all those things have changed now. See, earlier the basic problem with the bigger age group or anybody beyond 25-30 was because they are working. Nobody likes to go with braces to work.
Sure.
So it's something that they want to change their looks for, but at the same time they won't need to look ugly for the next 10-12 months so that they look beautiful at the end of it.
True.
So aligners have come in now. And then, I mean, there are 2-3 options. One is regular braces. Those are metal braces that you see. Same way, there are ceramic braces, which are like tooth-colored braces. So they are also quite invisible. From a nearer distance, they are visible.
Right.
मालूम पड़ता है कि there is something that the person is using. And there are lingual braces that are fixed from behind the teeth. And the latest and the best is aligners. Aligners is something which are basically very thin acrylic trays, or which you have to wear, and there are a series of trays that you keep wearing for say 6, 8, 10 months, and they get tooth movement. Now, what's the advantage of using aligners is nobody knows that you're using those, so nobody knows that you're actually undergoing any treatment.
Right.
So that is the biggest advantage. So people in public speaking, or want to go ahead with their treatment even during work hours, they're the best candidates for that. And they need around 22 hours of wear, 20 to 22 hours of wear. 2 hours, obviously you need to eat, drink, and lot of other activities. So
Right.
for that 2 hours are given, but they are very effective. I mean, in
Okay.
spite of it being a new technology, it's very effective.
Okay.
And specifically for this age group, it's very advantageous.
Okay.
With children, of course, braces are still the best choice. Even many children these days opt in for aligners. It's basically the parents providing, so it's their wish.
Sure.
So that is how braces work. Yeah.
I think one more question which comes to my mind is it a myth or truth that diabetes or thyroid patients are more prone to tooth issues? And if so, is there any special care to be taken for these patients?
Okay, it is not a myth. There is some truth to it. Okay, how I'll put it across is diabetes is basically, it does affect your oral cavity. Now, how does it affect? Most important thing, sometimes the side effect of diabetes can be dry mouth. Now, what is a dry mouth? We all know that the tooth, the inside our mouth, it is always moist. We are always having saliva in our mouth.
Right.
Now, that saliva helps us in a digestion of our food. It is specifically more when we eat. काय बघितलंय, यम, 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 असं करतो. So, that is one part of it. But the other part of it, it is something which regulates the bacteria in our mouth. It is something which gives us protection.
Sure.
Now, when a dry mouth happens, basically the salivary glands are not secreting saliva. The bacteria are there. So, the cleansing effect is not happening. These teeth are more prone to tooth decay
Okay.
than a normal person.
Sure.
A fun fact here is that usually 1 liter of saliva is produced in the entire day in our mouth. So now in diabetic patients, if that is not happening, the teeth are not going to get cleaned. So
Right.
the teeth are not going to get that protection. So then they are going to be more prone to tooth decay.
Sure.
Another thing that happens in diabetes is gum issues, gum disease. Now gum disease is these bacteria, because of the dry mouth or because of diabetes, they are easily able to infect the gums.
Hmm.
So it is something called as pyorrhea, gingivitis, periodontitis. It is basically the bacteria enter into your gums and they start going deeper and deeper along the roots. So
Okay.
in the what happens is they are not now attacking your tooth structure, but they are attacking the foundation, that is our bone.
Right.
So what happens is eventually your teeth is going to be there, but you will see mobility because the foundation is no longer exists. So these problems are seen more in a diabetic patient. Another thing with thyroid also, mostly dry mouth is a side effect that we
Okay.
see. So in such cases, what we will advise the patients is ki regular cleaning, scaling, polishing, or basic prophylaxis, in which a patient comes in and we do cleaning of gums. If that covers, entire cleaning of the lower jaw, upper jaw, that is to be advised, or we will advise them to come more often. Like we usually say, come once in a year, or come once in 6 months. Now, what happens is when a patient walks in every 6 months and dental pain is no longer the issue, and when you do cleaning, you see, there's one small cavity here, or there's one small something to be addressed. It can be dealt at a very, very initial stage.
Right.
And that helps because these patients are more prone than a normal person.
Right.
So yeah, this is what I will like to advise a person who is, having uncontrolled diabetes or controlled diabetes: regular checkups, regular prophylaxis, and that is going to help that patient mostly.
See,
Sorry.
another thing that I want to add here is, I mean, even if it's your car that you're using, you take it at least once in a year to the workshop, to
Yeah, for
get the oil
servicing.
changed,
Yeah.
servicing done, thinking that this might break down suddenly, in
Sure.
spite of having no complaints.
Right.
Why don't we do it with our own teeth? Go to the dentist. Ideally, it's 6 months, but I would say at least once a year. Go and get it checked and get the problem rectified right in the first stage.
Right.
You know?
Another thing what we can do is, if there is a patient with dry mouth, especially with diabetes or thyroid, there are supplements which are available. Supplements will initiate saliva secretion. So the patient can use that, to protect his teeth. So that can be done. So that is why, yeah, diabetes does require care and they need to consult a dentist.
Okay. For diabetes patients, I think we covered most of it. But I had another question. My understanding is for diabetes patients, typically healing of wounds is a challenge, or rather, it takes time, right? So, is there some special care or process followed for these kind of patients?
See, as I told you, we always check with the HbA1c measure, HbA1c tests for these patients. And also, if the diabetes is out of control, we try to control it with the help of the patient's diabetologist. But thankfully, till now, I mean, so many patients I have treated, oral wounds heal very properly in diabetics.
Okay.
Usually, there is never a complication.
Okay.
Sometimes you see a bit of bone loss, but that's about it. But yes, oral wounds heal very, very nicely.
Okay.
So if anybody has that doubt in their mind that how will my wound heal, should I go in for an implant or no, just take it out of your mind. Go to a good dentist. They'll help you out with it and go ahead with the treatment.
Okay.
Should not be a problem. Should not be a problem.
Okay. With younger generation, do you think there are more complaints with wisdom tooth? How do you handle those?
Well, that's a very good question. See, coming to wisdom teeth, the name itself, wisdom teeth.
Yeah.
The reason for the name is that they usually come after the age of 16, 17, where it is normally assumed that a child, I mean, attains a bit of wisdom. So that is why it's called wisdom teeth.
Right.
Now, why are there so many issues with the wisdom teeth? So it's a developmental thing. I mean, as we have kept on, developing or
Evolution.
evolving throughout the generations, the size of our brain has been increasing, and the jaw has to compensate for it.
Right.
The size of the jaws has not increased,
Right.
but because the brain size is increasing, it has tried to encroach upon the jaw.
Right.
So the size of the jaw has reduced, but the number of teeth is the same.
Right. Right.
Now, these wisdom teeth, which are the last to come, somehow are left out with no space to come out.
Right.
So that is the time when you see they are impacted or they are stuck either inside the bone completely or stuck with the front tooth. So these teeth, whenever they come, they'll try to somehow try to wiggle out of the space that is available for them.
Right.
So sometimes they do come out, sometimes they are completely impacted. There are 2 3 types of impactions. They're horizontally impacted, they're vertically impacted, they're obliquely impacted. So it depends on the kind of impaction you're having and how to treat it. See, if it is bothering a person too much, like every second, third month, they're going through this infection that they have. It's called pericoronitis. Typically, it's the infection around the gum tissue of this impacted tooth. Then we always recommend to get these teeth extracted because the longer they stay, the more they're going to bother you.
Right.
So ideally, get these teeth extracted.
Okay.
That's the best solution for them. And the most important thing is what otherwise they all wisdom teeth usually share only 4% of all masticatory loads.
Okay.
So they're not an active member of chewing.
Okay.
They're there to just bother you. So better to get rid of them. Usually we end up extracting.
Okay.
Depending upon the complicated position of the wisdom tooth, the dentists who are specializing in this are known as oral surgeons.
Okay.
So they are the people who specialize in this, and they are the people who treat such cases.
Okay.
Because the positions are complicated. Then there is going to be a surgery involved where you might need stitches.
Okay.
So there is nothing to be scared of in it because we have oral surgeons who are doing this only day in day out. So they are the people who take care of such kind of problems.
Okay. Okay.
This thing.
Oral surgeon is the person to handle this.
Another issue that we've seen is wisdom tooth is wisdom teeth, since they don't have space, they are partially erupted. Now, what is partially erupted? When you see your tooth, you see the entire tooth. In wisdom teeth, you will see only one white head, one cusp, and rest of the tooth never comes out because it doesn't have space.
Okay.
Now, this area becomes an area of food lodgement because it's so far behind, and we are in such a hurry when we get up in the morning and brush that we don't even take the brush till inside. So what happens is those areas never get cleaned.
Right.
And if the food keeps on getting stuck there, it is going to cause cavities.
Sure.
Now, wisdom tooth is inside the bone, so it is not going to decay, but we are going to lose a good molar, the molar which is there beside that wisdom tooth,
Right.
and that tooth goes for root canal and decay, cavity, everything. So when wisdom tooth is causing any problems, we usually advise ki get them removed.
Okay.
And if it is a surgical intervention, we call a oral surgeon.
Okay.
If it can be easily removed, then it is done by a general dentist also.
Okay. Sure. So, if a person pulls on with pain due to cavity, what are the probable complications?
Okay, that's a very good question. What happens when you continue with pain? See, as Indians, we are very tolerant people.
Right.
Now, tolerant to that level that we tolerate a bit of sensitivity. That sensitivity goes down to a bit of pain. We still tolerate it. But I am not going to go to the doctor, okay? I am good at tolerating. Then
Or priorities are different.
priorities are different. You're very busy, but you don't have the time or the inclination to go to your doctor or dentist.
Right.
Then the pain starts. You have a lot of pain. Then you'll call the dentist, telling him, please give me a painkiller. I need to take care of this pain. You'll take the painkiller, the pain subsides, and my tolerance again increases.
Right.
So I'll keep on pulling with that pain till the point where the pain is so bad that when I go to my dentist, he is going to tell me, dude, this is an extraction now. I can't do anything for you.
Right.
So tolerance is good, but not in these things. So of course, this is how pain plays a part. Now, Dr. Mrudula will elaborately talk on it.
Yeah, pulling on with the pain is not a good thing to do because pain only occurs, just as we had discussed before. Pain is seen only when the good portion or the soft portion of the tooth is infected.
Right.
So now you have a source of infection in your mouth. You go to a doctor, he's going to give you painkillers, he's going to give you medication. After taking the medication, you usually feel good. Okay, suddenly you feel, the pain is gone. Do I need treatment? And then other things start, you see the other priorities that you have and you say,
Right.
dekh lenge, baad mein dekh lenge.
Right.
What happens is, once we have a dental problem, tooth don't repair themselves. Let me tell it again. That problem is just going to become from bad to worst.
Right.
It is having a spiraling effect. You might not realize that it is happening in your mouth, but it is happening. This infection is going to become a chronic infection. No longer it is acute. Now, what is acute? When you have pain, you rush to a doctor. हार्ट अटॅक होता है तुम्ही जाता पण हार्ट अटॅक यायच्या आधी देर आर मेनी सिक्वेन्स ऑफ इव्हेंट्स विच आर हॅपन विच यू हॅव इग्नोर्ड सो दॅट इज द क्रॉनिक पार्ट ऑफ इट which is their long standing infection. Once a chronic infection sets in, you are going to have issues like the tooth is going to break down. What will happen? Pain will not be there, but other things start happening. Tooth breaks down, roots get infected, you are going to lose the bone, pus is going to be there in that area. So by the time you go to a dentist, the situation is going to be so bad that extraction is the only option that he has. Probably the things are going to be so bad that implant is also not a viable option because the bone destruction is so much that I can't even place an implant. So I will say never wait for the last thing to happen. Always when you get the first sign, the first warning, please visit a dentist. And that the idea is कि when I go to a dentist, there is pain. म्हणून मी नाही जाणार, पेन होतंय म्हणून पण मी नाही जाणार, पेन होईल म्हणून पण मी नाही जाणार. Please remove this word pain out of your mind because today dentistry is very safe. It is painless. We say we are doing painless root canals. We say we are doing painless fillings. And it is really possible. So that is what I'll say, bad to worst. And you are just neglecting to a point where it becomes difficult for a dentist also to give you very good options in treatment.
Right.
And at the same time, the last stage that you walk in, the expense is that high. You come for a filling, it's this much expense.
Sure.
You go for a root canal, it is this much expense. You go for an implant, it is this much. And when you go at the end, full mouth you have, the expense is this much. So stages with ignorance and neglect, you are going to increase your expense, treatment time, and everything.
So, would you like to advise our viewers on how parents can prevent cavities within their children and what good practices they can inculcate to have a brighter smile?
See, two way it can be handled. One is by the parents and of course by dentists. But always it starts at home.
Yeah.
So as parents, it's their duty, I would say, to see what the child is eating throughout the day. So what you can control, basically, of course, as parents, you try to give the best to your child. The best would be fruits, a mild amount of carbohydrates. You avoid sweets. That is what you try. But many a times I have seen that the refrigerator has all the things that you are trying to avoid. It might be cakes, it might be chocolates, it might be colas, soft drinks which are loaded with sugar. I would like to add a lot of sugar goes into making these soft drinks, and that's liquid sugar which goes into each and crack and crevice of your child's tooth. And that is the biggest reason for decay.
Okay.
Of course, sweet things are there, but that's the biggest reason. So, as parents, the best thing that you can do is stop keeping these things in your refrigerator
Right.
completely. And if you're worried, what happens if my child is not going to get any sugar? They have it enough throughout the day in their school, college, and all those places they go.
Right.
There is a birthday every day in school where a chocolate is given,
Right.
and your child is inevitably going to eat it.
Right.
They are not going to refuse it. So don't worry
Sure.
about that.
Sure.
That is how it comes to eating. Now, second part is how you can keep the teeth clean. See, normally what I've seen is parents themselves don't brush in the night. And when you're not doing it yourself, you cannot instill that in your child.
Right.
Children learn from us,
Right.
The moment they see that my mom, my dad, they're both brushing in the night and sleeping, it becomes their duty automatically to brush and sleep. But when they don't see that their parents are not brushing and they're trying to tell them, तू ब्रश करके सोने का आहे, तुला दात घासूनच झोपायला लागेल. द चाइल्ड क्वेश्चन्स, तू तर कधी घासताना दिसला नाही मला, मी का घासायचे? It's not wrong in that child's part,
Absolutely.
So ideally, you should start brushing yourself. Kind of instill that in your child. So you have the right to tell them, dude, I'm doing it. You need to do it.
Right. Lead by example, basically.
Lead by example, exactly. And the thing is, what happens if you don't brush throughout in the night and sleep? See, throughout the day, you eat a lot of food. Even it might be home food. I'm not saying it has to be carbohydrates or sweets or anything. Whatever you eat in the night, the salivary flow completely stops.
Hmm.
So, whatever is there on the mouth is going to get eaten up by the bacteria.
Right.
And that is where, as Dr. Mrudula earlier explained, tooth breakdown or tooth decay starts. So, brushing in the night is very important. Now, this is what parents can do at home. Now, coming to the dentist part.
Right.
See, ideally, every 6 months, everybody should visit, be it a child, be it a parent, or an adult. You have to visit. Now, as dentists, what we do is we check if there is any initial decay that is starting on your child's tooth.
Right.
If we see any initial decay or even a chance that there might be decay, because there are pits and there are cracks and crevices on the top of your teeth, there are cusps that are high, there are valleys that are grooves. These always collect food.
Hmm.
And if we see these are very deep, then we use pit and fissure sealants to close these grooves. So
Okay.
there is no decay absolutely in the first place.
It's a preventive treatment.
It's a
Sure.
preventive kind of treatment
Sure.
wherein you don't end up with any cavity later on. So that is one important thing that you can do. Second is fluoride treatment. Fluoride is known to, remineralize the enamel many a times.
Hmm.
If there is initial decay and proper amount of fluoride is given at regular intervals, the decay is arrested.
Okay.
So you can actually arrest a bit of decay and avoid any more new decay to come in.
Okay.
That is the importance of fluoride.
Sure.
So, whichever toothpaste, now I'm going to the toothpaste part of it, you're using, see that there is a bit of fluoride in it.
Okay.
Age related, of course, in pediatric or the small children, the toothpaste and the content of fluoride is different. For
Okay.
adult, it's different.
Sure.
But your toothpaste ideally should have fluoride.
Okay.
Use a toothpaste with fluoride.
So preventive treatment comes under fluoride application, which is done at regular intervals, and pit and fissure sealants. When a patient walks in with this for preventive treatment, if there's any treatment, other treatment that is needed treatment also can get covered at very initial stage.
Okay.
And another thing is we have pediatric dentists, just as I told you. So I will advise the parents to work on this two ways. One is home and do visit a dentist as you early as possible. So you can start with preventive, so end up with no damage later on.
Sure.
And another thing that comes in is crooked teeth. When we have this stage from 6 years of age to 10 years of age, where the milk teeth, we have 20 milk teeth and 32 adult teeth. The 20 milk teeth fall away and we get in adult teeth as the age goes till the age of 12 or 13. So there's this ugly duckling stage we call, where there are half milk teeth, half permanent teeth, and the parents fear that they are not in the right place, they are looking crooked. What options do we have at that particular time?
Right.
So if the right age, if they come in at the right age, there is something called as, we can use the growth spurts of this age group, and we can control the expansion of the jaws, and we can control basically the eruption of the permanent teeth to give it a
Okay.
better alignment.
Sure.
See, many a times you see crowding.
Hmm.
Crowding of teeth, it's basically less amount of bone
Hmm.
and more amount of tooth material that is there.
Okay.
So teeth will come out in that limited amount of bone. So many a times what the orthodontist will do is they'll try to expand the jaw with certain biomechanical appliances.
Okay.
So once you get that expansion of jaw, immediately the available bone increases. So the
Okay.
crowding can be reduced.
Okay.
So later part of the treatment is much more easier.
Or there might not be a need of
Or
braces.
yeah, you can completely eliminate the need for braces if this is done at the right point of time.
But
Okay.
it depends on what time the parents are getting the children inside the dental clinic.
Right.
So
Right.
then only we can do it better.
Yeah.
So, on similar lines, do we want to suggest any kind of do's and don'ts or healthy practice, I would say, for our adults?
With adults, the first thing and foremost thing which we are constantly hammering, I think, through the entire discussion is this, that teeth don't repair themselves. You are going to need dentist. Dentists are the only people who can help and correct whatever is happening, damage is happening in your teeth. The first thing that I will always advise is oral prophylaxis.
Hmm.
Now, this is a preventive kind of a treatment where we are cleaning the gums on a regular basis. Usually, it is advised once in 6 months, but we say once a year, get it clean. So, basically, two things happen. First is checking. We do a complete oral checkup. We find initial problems or bigger problems and we treat them, and the entire cleaning of the gums is done. Now, why is prophylaxis necessary? Prophylaxis is necessary because saliva in our mouth hardens up, and you must be realizing there are this uh, deposits on your teeth which never go away with brushing.
Right.
Whatever you do, the brush cannot remove them, and they don't go away with brushing. You need a particular instruments in our or machines in our practice through which only we can remove the tartar calculus,
Okay.
which is harmful. And gum disease never pains.
Okay.
Tooth always pains,
Hmm.
but gum will never pain. You will see bleeding ho raha hai, there is bad smell, but I don't know what is happening. I have no pain. That is how the patients tell me. So I tell them gum disease never pains, so but we have to do the treatment. So the first thing that will always start is go to a dentist regularly. Second thing is eating habits. We have covered most of them with kids. But
Right.
again, I like to specify that today and everything is very easily possible. Just regulate your eating. Try to go for fibrous foods. Eat more of fruits and balance your diet. That is one thing that I'll surely say. Brushing in the night. Now, brushing. In brushing, the most everybody asks me, what toothpaste should I use? All patients in their maintenance phase ask me what toothpaste. I always say toothpaste is an important component, but more important is how you brush.
Hmm.
So today mechanical brushing is there, which we have been using for years and years, but people don't change their brushes.
Hmm.
They buy a brush and it is just there for six months, and after 6 months they're like, okay, I need to change. Every brush has to be changed every 2 months
Okay.
for your entire family. Make it a point. Put something on your calendar, make a note, I don't know, whatever. But brush has to be changed. After 2 months, the brush is just like a painting brush. It is not mechanically cleaning your teeth. It is just taking the food from here to there, from there to here. So basically, you feel that you have done it, but it is not happening.
Okay.
So brush has to be changed every 2 months. Second thing, the design of a brush. A brush has to have a smaller head. A brush is having a head and a shaft. Smaller the head, better the cleaning. Why? Because our teeth are not in one line. They are in a curved panel. We have our tongue, we have our cheeks. So the brush has to go till the last area of the mouth to keep it clean. Longer the brush, it is never going to reach. You
Right.
are going to end up with cavities on your behind teeth. So smaller head of brush is what I will advise. Third thing is how much toothpaste should I use when I brush? I say use around a pea sized toothpaste is enough. And make sure that your brush is consciously going till the last area. Now, these days we are having electronic brushes. Trust me, they are very good. What happens is we cannot regulate the pressure that we are putting on our teeth when we are brushing. Many people feel more pressure I put, better cleaning I'm going to achieve.
Right.
And what happens in this is they're damaging their teeth even further because more pressure they put, enamel is lost.
Okay.
And once enamel is gone, it is gone. You cannot regenerate enamel. So then you are going to end up with sensitivity, decay, issues. So there's a particular pressure that has to be applied while brushing. In an electric brush, the pressure is already monitored. So,
Okay.
and the head of the electric brush is always very small. So, what happens is at one time it cleans only one tooth. So, consciously you are cleaning all the teeth. And that is why electric brushes are much better for cleaning purposes. Another thing is what can be used is flossing. I don't know. Floss is basically a nylon thread which is waxed
Right.
and which is available very freely in medical stores. Flossing is something now I am brushing my teeth, but teeth are all individual. They're not joined. So every tooth beside each other is having a space which cannot the brush cannot reach. So flossing is used for interdental cleaning in between the two teeth, whatever food is getting stuck. So usually we say floss in the night.
Okay.
So you remove all the food that is stuck in all the gaps
Right.
and then you sleep. So the chances of dental decay reduces. Flossing, if you're trained, once you get trained yourself, flossing takes less than 10 seconds. But
Okay.
द फोबिया इज देअर की हे मला जमणारच नाही. हे कसं करायचं? तिथे कसा जाईल माझा धागा? सो वी हॅव हँडल फ्लॉस. We teach flossing to patients. I actually sit and put a mirror in front of them and I tell them, "Okay, now I am doing, now you do." So your dentist will take an effort to make you understand how to do flossing.
But the cleaning aids have improved. There is a floss at the end of a stick, so it's much more easier to use. And about the electronic brushes that Dr. Mrudula was talking about, they are a very effective tool for cleaning. The only thing is they don't produce as much foam while brushing as a regular brush does.
Okay.
So mentally you wouldn't feel
Psychological.
satisfied. It's a
Hmm.
psychological thing. पता नहीं मेरे को दांत घिस तो दिया, दांत घिसा कि नहीं समझा नहीं लेकिन,
Hmm.
but they are effective.
Okay. Okay.
And third thing, another maintenance aid which has come in is known as water flosser,
Okay.
which is also a very good tool. Now imagine it's a very highly small jet of water at a very good pressure. So basically, you just have to hold it at the edges of the gums and the tooth. What it does, the pressure of the water removes any food particles which is stuck anywhere. You just have to do it, move it in the mouth, and that is done.
Okay.
But this is another one thing which viewers and I think in general people are not aware of.
Okay.
And as a dentist, I will like to make them aware that these tools are available. The more you use this maintenance phase, less you have to come to me.
Yeah, and you don't have to be afraid about using them. It is not going to cause any injury.
Right.
These things are very well regulated and well made, so they're a very good tool to be used.
Okay.
Ideally, use it.
Okay, this is the maintenance phase. Now, coming to the treatment part, like I have talked about, first you try to control your diet, reduce your sweet, sugar, colas, brush in the night, very important. Try to follow and use these tools to improve your oral hygiene. Now, third thing that I will like to address is please visit the dentist. But just as I told you, every 6 months. But by chance you are not doing that, don't ignore and neglect your pain. We talked about it.
Yeah.
What happens is the later you come in, more treatment you are going to need. So that is one aspect I would like to tell. Another thing is our teeth have a particular way of sitting on each other, which we call as alignment. Our teeth are having a particular set of alignment. The minute tooth breakdown starts, this alignment gets disturbed.
Right.
Now just try to imagine the tooth is so small and everything is in such a small thing. The gap is so small. But for a gap to happen also, it takes time. The tooth alignment breaking down takes years, maybe 1 year, 2 years. There's something missing. Then the teeth tend to shift. They are not fixed in our jaw. They have a movement. It is like, if I have to explain, मोत्याची माळ आहे. एक मोती तुटला की हळूहळू ते मोती असे दोन्हीकडे फिरू शकतात, कारण तो एक मोती मधला गेलाय. तसेच तुमचे दात आहेत, मोत्यासारखे आहेत. कधी-कधी एखादा मोती म्हणजे एखादा दात ब्रेकडाऊन झाला आणि आपण तो फिक्स नाही केला, आपण तो ट्रीट नाही केला, तिथे आपण नवीन आर्टिफिशियल दात नाही लावला, व्हॉटएव्हर वी डोंट, ऑल द टीथ टेंड टू शिफ्ट स्लाइटली. नाउ दिस इज ऑल इन millimeters, or very small space. But that space is enough for food to get stuck in that areas, lead to dental cavities. Eventually, you are going to have 4 teeth having dental decay within next 3 years.
Right.
So another thing which I will like to make patients or the viewers aware is don't leave missing space in your mouth. You know that there is a problem, go and get that place fixed. Implant kara, bridge kara, temporary removable kara, but don't leave a space because that is going to happen. A long-term effect is going to come in.
Right.
Yeah, don't always think कि मेरा मसूड़ा बहुत मजबूत है, मैं उसी पे चबा लूंगा. It doesn't work that way. Eventually, everything breaks down.
Hmm.
So kindly replace your teeth in time.
Right.
And last point that I will like to tell is people are scared of dentists because they are scared of the noises. One thing is the handpiece that we use, it generates a particular sound. They are worried about that sound. Second thing, they feel ki assumption is ki once I go to a dentist, I am going to end up in severe pain. Third thing that they assume is ki माहिती नाही काय होणार आहे. Get all this out of your mind. Today dentistry has become very painless. Another thing is it's become more predictable. I talked about so much machines. Like that, I will like to elaborate one more technology which has come in, which is known as CBCT. Basically, it is
Yeah, it's a cone beam computerized tomography. We specifically use it just before doing implants. It
Okay.
gives me a good idea about the bone, in 3 dimensions, the height, the width, even the density of the bone.
it gives an idea about anatomic landmarks that we are going to be encountering if we do this surgery. It gives us in wisdom tooth surgery. Sometimes we go in for this diagnostic tool because it gives me the position of the wisdom tooth with the mandibular nerve. So when I'm doing, I know exactly what I'm doing.
Right.
So because of that, everything has become so predictable that we can easily do what we are targeting.
Sure.
And that is why the other factors, pain, inflammation, unnecessary anything, is eliminated. So it's a very, I will say the treatment has become much more easier and predictable. And that The viewers need to understand.
A
Don't get
recent
scared.
a recent advancement was about 8-10 years back. We used to read about 3D printers and we used to wonder how is it possible. 3D printing. You just take a picture and a 3D print comes out.
A
But
mission impossible.
yeah, it was a mission impossible some years back, but it's a reality in dentistry today. And we have scanners. These are 3D scanners. We just scan a case. And specifically, as I was explaining earlier about aligners, they work on this principle.
Okay.
We take a scan, it gives the exact position of the tooth. This scanned file, we email it to our lab. The lab has a 3D printer. They print the scanned file. It comes out as a cast. It's something that they replicate exactly as in the patient's mouth. And that is how the whole treatment is worked out. The whole braces concept is worked out. How many aligners the patient is going to need, how long the treatment is going to take. Everything is worked out on that. And then we
Right.
tweak according to our requirements, if we don't agree with the computer's program. But that is how, 3D, these
Scanners.
scanners work. And not only in orthodontistry, but even in smile designings and other
Prosthetic work.
prosthetic
Everything.
work, they
If
help a lot.
if you have gagging, ओकारी येते. तोंडात काही टाकलं की ओकारी येते. Imagine those patients we were not able to treat very, it used to be a problem for them and us to take an impression. Today scanning is so easy. I just need to scan. They are not going to feel any discomfort.
Right.
Earlier, we used to take material like ice cream, load it in the tray, and put it in the patient's
Right,
mouth.
right, right.
So all that can be eliminated with the use of these
Scanners.
scanners.
And another thing is what has happened is there are a lot of dental softwares available. Today you have come to me with a problem and you want to know the treatment options, you want to know the treatment planning, and you want to know the end result. Today I have the capacity to show you that this is what I am going to achieve. And when you see that this is going to be my end result, you will know, okay, हे असं होईल असं होणार आहे. So everything is reverse engineered now. So we start from the end, we go to the end, and then we reverse engineer, and that is how the treatment is done. So it has become very easy to convince the patients also and to tell them what all we can do. We can show them stepwise also.
Right.
So this is a different dentistry. That is what I am trying to tell. Ki things have improved beyond anything. No longer it is की dentist फक्त दात काढतो. आता डेंटिस्ट दात काढतच नाही असं झालेलं आहे.
And there is awareness amongst patients also. Many
Right.
patients come and tell us they don't want an extraction,
Yeah, they
when in fact it's an extraction, and they want to still save the tooth. So we have
बोलले
to
ना
convince
प्रश्न
them otherwise.
Right, right.
Okay. And I will really like to thank you for giving us this opportunity to come here and
Yeah.
talk so much. It is a pleasure. It is nice that if we are able to reach so many people at one time, and make them aware ki don't come at the last minute.
Right.
Come at the start.
Right.
That thing की डेंटिस्ट्री एक्सपेन्सिव्ह आहे. ते एक्सपेन्सिव्ह होते कारण तुम्ही येता तोपर्यंत खूप डॅमेज झालेलं असतं. पण तुम्ही जेवढ्या लवकर याल तेवढी ती एक्सपेन्सिव्ह पण नाही आहे, पेन फ्री आहे, खूपच रुटीन आहे. दॅट इज व्हॉट आय विल
Here you come, you are going to have less expense, and most important, less pain. Always remember.
Yeah, and thank you so much.
And thank you so much. Thank you so much for
Pleasure
inviting
was
us
mine.
over.
With this, let me take this opportunity to thank Dr. Sanjay and Dr. Mrudula for their valuable time today and for sharing insights on dentistry and emphasis on prevention rather than cure. Wishing you both success in your noble work in the field of medicine towards getting your patients to smile with confidence. There is a famous quote by Phyllis Diller: a smile is a curve that sets everything straight. Stay positive and keep smiling. Dhanyavad.